Welcome back. You're watching In Focus. It's time now for our Africa Health Network update.
And as usual, health reporter Linord Moudou is here to tell us how the weather is affecting the rise of a dreaded disease. Hi, Linord.
Hello, Dimiake. Hello, Vincent. And hello, everyone. Well, in Niger, an unusually heavy rainy season is causing an increase in malaria cases in parts of the country. Health workers say higher numbers of malaria cases have been recorded in the Maradi region in south-central Niger. Most communities in the region are already struggling with severe food shortages, hunger, and malnutrition. At the Gidan Rumji Hospital, hundreds of women and children line up outside the hospital to receive medical care. Many others have been admitted to the pediatric ward with severe cases of malaria. Healthcare officials at this hospital say they are overwhelmed by the increased number of children as opposed to the limited resources available to care for them. To help ease the caseload, medical aid agency Médecins Sans Frontières has stepped in to help coordinate treatment and distribution of basic food, especially for malnourished children who are at high risk of death.
We have a lot of children coming here suffering from malaria. We have to put 3 children on each bed in the pediatric unit. But on top of that, we get more children who are malnourished, so we're admitting more children in the malnutrition unit as well. So at the moment, we are overwhelmed by the numbers, but our teams are doing the best that they can.
We cannot dissociate malaria from poverty. The two go hand in hand. People are poor. The season has been bad. People are just fighting to find something to eat to survive.
Last year left Niger and neighboring Sahel countries with a food emergency. According to aid agencies, nearly 2 million people in Niger are now suffering from hunger. As heavy rain is causing an increase in malaria cases in Niger, well, rains and floods are posing a threat for cholera to spread faster and further in West Africa. The World Health Organization and UNICEF recently warned the current cholera emergency in the region is primed to get much worse. Joining us via phone from Brazzaville, Congo, is Dr. Hama Boureima-Sambo, Acting Director of the Disease Prevention and Control Cluster at the World Health Organization Regional Office for Africa. Dr. Boureima, welcome to the show.
Good afternoon.
Well, good afternoon. It's good to have you. According to the most recent report, there seems to be a decline in new cholera cases. However, the disease continued to spread. So could you please give us a sense of what is happening? Is the situation improving or is it getting worse?
Yes, I guess I can say between January and early September 2012, about 12 countries in the West African region, but 22 countries in the African region have reported cholera cases. Some countries having cholera outbreaks. Out of the 12 countries in the West African region reporting cholera, about 31,066 cases of cholera have been recorded, with about 502 fatalities, case deaths. This is what's happening in West Africa. In countries where the cholera outbreak have been recorded, we have been observing some decline in cases recorded on a daily basis.
Now, Sierra Leone and Guinea are two of the countries where there seems to be a little bit of a challenge there. Can you tell us exactly what is going on in these countries specifically?
Yes, in Guinea and Sierra Leone is really where we have recorded the most cases. Sierra Leone being the hardest hit, with about more than 15,000 cases recorded and more than 260 deaths, leaving a case fatality rate of 1.6. Guinea has a bit more than 5,000 cases and more than 100 deaths. But I can say in the two cases, in the two countries, especially in Sierra Leone, WHO and partners have set what we call the C4 center. This is the Cholera Command and Control Center. This is a center that helps manage, prevent, and manage the outbreak when it reaches a level that it goes beyond the capacity of a single country. So, besides Sierra Leone and Guinea, some other West African countries such as Ghana and Niger have been recording cases, about 5,000 cases in Guinea and more than 3,000 cases in Niger.
Now, do we know why Sierra Leone seems to be most affected?
The why, we will certainly try to answer to all these questions where the epidemic is over. But we know the cholera is a disease when there is a gap in clean water and sanitation coverage, where we observe population displacement, and many other factors that can make an epidemic worse. And what we have been observing in these countries is that the case fatality rate has been declining, meaning that at least case management has been up to very good standards. But heavy rains, population displacement, gaps in clean water and sanitation are the main drivers of this epidemic in all of our countries.
Now, considering the disease is spreading in the West African region, is there or should there be a regional approach in tackling this issue?
Yes, cholera epidemics are associated with high mortality and morbidity, as I just said. And under the international health regulations, cholera is one of the notifiable diseases. It can spread rapidly across international borders if risk factors are not very well controlled. So, in addition to inadequate water and sanitation and insufficient hygiene, harmonized regional strategies are very good. That's what we call cross-border cholera control. Countries sharing same borders can harmonize not only their approaches but intervention to control the disease, both in terms of going upstream to try to prevent and also harmonizing regional approach in the control of the epidemic. So definitely regional approach is one of the way WHO has been supporting countries to discuss among themselves, see what is common, what kind of common approaches they can have in prevention, and also in many cases, in some cases, some situations, even case management.
Okay, Dr. Boureima-Sambo, that's all the time we have today. Thank you so much for joining us.
Thank you very much.
And that was Dr. Hama Boureima-Sambo. He's the acting director of the WHO Africa Region Disease Prevention and Control Cluster. And that's our Africa Health Network report for today. For more information, you can visit us online at africahealthnetwork.com. Vincent Dimiake, back to you.
Well,
thank you so much.
Thank you very much. I want to thank you for joining us today. Be sure to watch for Linord Moudou's every Tuesday and Thursday for the latest health news in Africa right here on In Focus.